Second Corinthians 2 and 11. Lest Satan should get advantage of us, for we are not ignorant of his devices.
In today's morning rounds, a new virus that has killed 9 people and infected hundreds more in China has now spread to the U.S. A man in his 30s from Washington state is the first person in America to be diagnosed with coronavirus, it's called. The man returned to the Seattle area last week from a trip to Wuhan. That's a city in central China where the outbreak began. Right now, that patient is in isolation in a hospital north of Seattle.
Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health. We also want to make...
Enhanced screening is already in place at 3 U.S. airports, with 2 more being added this week. Our Dr. Tara Narula is here at the table with more on this story. You hear about it, you see the mask, it's very disturbing. How worried should we be?
Yeah, I mean,
what is it exactly?
So this is a form of a coronavirus. We've known about coronaviruses before. This is a new strain. This is a virus that's found worldwide. It causes typically a mild or moderate respiratory illness, but it can be more severe. We saw that with SARS and MERS, which are also forms of coronavirus. So certainly the CDC is recommending that we be cautious about this, that we be proactive, because it is a new strain. It is contagious. So interestingly, they think it does circulate in animals, and occasionally can make the jump from animals to humans, which is what they think happened in this case, because the initial cases were surrounding an area, a market, a seafood animal market in the Wuhan area. And so they think that it started in animals, it was transmitted to humans, and now they're saying that in fact it is spread between human to humans.
And there's no vaccine right now, so how are people being treated?
There's no vaccine. The NIH is doing research to develop a vaccine, but that's a ways away. And so it's really supportive care at this point, which means, fluids, rest, pain medications, medicines to lower fever, temperature.
How are health officials tracking the spread of this virus? How are they looking for people who may be infected?
Well, certainly with this case, they've sent, a team to Washington, and they're doing a trace back where they're looking at everyone that this gentleman may have come in contact with back in China, on the plane, in the United States, and they have activated kind of their emergency operations. They're also in communication with the WHO, which is convening a meeting today to decide whether they're going to declare this a worldwide public health emergency.
We see these pictures of people wearing the kind of the masks out in public. Do those do anything to prevent infection?
Well, certainly we think that this is spread by droplets, so, airborne precautions like wearing a mask can help. Also, if you touch a surface, kind of like the flu, it can be spread that way. So hand washing, disinfection.
What are the symptoms, Tara?
So it can be anything from fever to cough, respiratory difficulties, shortness of breath, muscle aches. It can progress to pneumonia. And, there have been some deaths, although the deaths that have occurred have been in those who are older than 60 and also seem to have underlying medical conditions. So I think the big message here is not to panic. The CDC is saying that at this point, the risk to the general public is low.
So if you haven't been to China or haven't been in contact with somebody who's been to China, do you have reason to be concerned?
I think the CDC is saying, again, the risk is low. So they said for anyone kind of sitting around their dinner table, this is not something that you have to be worried about. But certainly because it is a new strain and people don't have immunity to it and strains can mutate and change, they are worried. And that's why they're saying we need to be prepared and proactive and take kind of a widespread public health approach, which is what they're doing. And they've seen this before. They've done this before in SARS and MERS. So.
All right. Dr. Tara Narula, thanks.
Good day, fellow South Africans and citizens of the world. Bonsai sends you a special greeting as well. Now, we know the world is changing, and we know that technology is at the heart of all these changes. When Ramaphosa talks about the fourth industrial revolution, he's talking about artificial intelligence and so much more. And basically what's happening under the fourth industrial revolution is the complete control of the wider population by the very select and super wealthy. Don't believe me? Right now, they're bringing out a vaccination that will include a microchip that will identify you forever. so that you can be tracked and traced. This is the sign of the beast we're talking about. I mean, the Bible talks about this, or the mark of the beast. For years we've been watching as Microsoft founder Bill Gates, now retired from the company he founded, uses billions to give free vaccinations to people in third world countries. Now Gates has become a founding partner in another company. This one is called the ID2020 Alliance, and its goal is to give every human being on Earth a digital ID, a footprint, something that can be tracked. How do they plan on accomplishing this feat? By combining mandatory vaccinations with implantable microchips. Genius, isn't it? And coming soon to a theater near you, as the saying goes. Now, let's quote Revelations 13, verses 16 to 18. And he causes us all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads, and that no man might buy or sell save he that had the mark, or the name of the beast, or the number of his name. Here is wisdom. Let him that hath understanding count the number of the beast, for it is the number of a man, and his number is 666. Now that's straight out of Revelations. And this little microchip that Gates and the United Nations and the Soros Foundation and Open Society Foundations and all these feral people want to implant into every human in the world is all about control. So now you know that Bill Gates and his wife Melinda were really doing over the past 10 years, traveling to third world countries and giving free vaccinations to the poor, downtrodden natives. Those free vaccinations was research and a live testing lab to conduct the necessary experiments required to form ID2020. And if you think I'm talking bullshit, I'm attaching 2 videos to this intro where you can actually see where they're boasting about the benefits of ID2020. This is official promo videos promoting the idea that everybody should be microchipped. And as you'll see today, this unholy hybrid of vaccinations and implantable microchips is already happening in Bangladesh. Soon it'll be Boston. A page on the Gates Foundation website says that Bill and Melinda have so far invested 2.5 billion US dollars to this project with no end in sight. Can the man who put the world behind a personal computer now put a vaccination microchip digital ID into the global population? Bill Gates is absolutely positive he can, and indeed is well on his way to achieving that goal. So, I'm going to say no more than I'm just going to attach these 2 promo videos which suggest that microchipping everybody on Earth is really cool. It's a way to go. Absolutely disgusting. The mark of the beast. Alright guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video, please share this video, and above all, stay safe. Bye for now.
The ability to prove one's identity is a fundamental and universal human right.
We live in a digital era.
Individuals need a trusted, verifiable way to prove who they are,
both in the physical world
and online.
Over 1 billion people worldwide are unable to prove their identity through any recognized means.
As such, they are without the protection of law and are unable to access basic services, participate as a citizen or voter, or transact in the modern economy.
La mayoría de esos afectados son niños y adolescentes. Muchos de ellos son refugiados, desplazados forzosos o personas sin país.
For some, including refugees, the stateless, and other marginalized groups, reliance on national identification systems isn't possible.
This may be due to exclusion, inaccessibility, or risk, or because the credentials they do hold are not broadly recognized.
While we support efforts to expand access to national identity programs, we believe it is imperative to complement such efforts by providing an alternative to individuals lacking safe and reliable access to state-based systems.
We believe that individuals must have control over their own digital identities,
including how personal data is collected, used, and shared.
Everyone should be able to assert their identity across institutional and national borders and across time.
La privacidad, la portabilidad y la persistencia son necesarias para que la identidad digital empodere y proteja a las personas de manera importante.
Digital identity carries significant risk if not thoughtfully designed and carefully implemented.
We do not underestimate the risks of data misuse and abuse, particularly when digital identity systems are designed as large, centralized databases.
Technical design can mitigate some of the risks of digital identity.
Emerging technology, for example, cryptographically secure, decentralized systems,
could provide greater privacy protection for users, while also allowing for portability and verifiability.
But widespread agreement on principles, technical design patterns, and interoperability standards is needed for decentralized digital identities to be trusted and recognized.
This better model of digital identity will not emerge spontaneously.
In order for digital identities to be broadly trusted and recognized, we need sustained and transparent collaboration aligned around these shared principles, along with supporting regulatory and policy frameworks.
ID2020 alliance partners jointly define functional requirements, influencing the course of technical innovation, and providing a route to technical interoperability, and therefore trust and recognition.
The ID2020 Alliance recognizes that taking these ideas to scale requires a robust evidence base which will inform advocacy and policy.
As such, our ID2020 Alliance-supported pilots are designed around a common monitoring and evaluation framework.
We humbly recognize that this is no easy task, but we see urgency as a moral imperative. This is why we have set ambitious targets and why we hold ourselves to account.
ID2020 is a global strategic initiative aiming to help deliver against the United Nations sustainable goal of legal identity for all. There are 1.5 billion people in the world who don't have a legal identity. No legal identity means no bank account and social exclusion. It matters to society as a whole. It's incumbent upon those that can to serve those that can't. It's going to be an annual conference up until 2030. There will be a mixture of non-governmental organisations, humanitarian agencies, technologists, innovators and policymakers. Technology cannot speak for itself. It requires innovators to talk to policymakers, and this is a forum at which we can do that. Legal identity for 1.5 billion people is complex. PwC does complex. Where would you start? Well, ID 2020 is simple and smart. The summit will look to examine the issues and to work out whether technology can be an enabler for societal good. Once a person has a legal identity, governments and non-government organisations can help people become safe, part of society, financially included and economically active. By bringing the right people to the table, focusing the debate and thinking of solutions that will affect up to a third of the world. The time is right to start today.
In 2001, a real-world exercise tested the emergency response to a bioterror attack on the continental United States. The operation was called Dark Winter. Within just a few days, the simulation spiraled out of control. The operation predicted a rapid breakdown in essential institutions, civil disorder, and massive civilian casualties. Dark Winter has revealed how vulnerable we've become. Our lifestyle, our security, our safety depends on a delicate and unstable economy. We've created a system so complicated that we no longer understand how to control it. Oil, power, shipping, transport. We live in a complex world. And the more complex it gets, the more fragile it becomes. The system is built on a global supply chain that gets things where they're needed, just in time. We've created a house of cards. Remove just one, and everything falls apart. And what's fueling this system?
Money. Americans can spend $90 billion in a single day of shopping. Last year, 200 million people swarmed their local stores on November 23rd. We call that day Black Friday. Did you know that a flu virus can survive on the surface of a banknote for up to 17 days? One day there will be a pandemic. It could begin during the crush of Black Friday sales. A pathogen will jump from tainted banknotes to human skin, onto food, toys, children, and loved ones. By the time patient zero feels the first sore throat, millions of people will already be infected. From this point, the breakdown will happen fast.
Day 1. Hospitals will reach capacity. Panic will strike. Day 2. Quarantine zones will be established. Resources will be rationed. Transport will go into lockdown. Day 3. International trade will stop. The oil will dry up. The stock market will collapse. Day 4. The power will fail. The shelves will be empty. The taps will run dry. And once hunger and despair take hold, people will do anything for survival. By day 5, everyone will be a potential threat.
In 2007, a new presidential directive was signed quietly into law. This maps out the government's response to a crisis, a plan to cope with a real dark winter. It is known as Directive 51. There are rumors of shadow agencies, sleeper cells, covert agents, but nothing can be confirmed.
Our complex world is primed for breakdown.
And once the chaos strikes,
there won't be resources to save us all.
The only question left is, what will it take to save what remains?